So this is the knee that I am worried about. And it's because he's backloading. And dogs put about 25 to 30% of their weight comes off of their hind limbs, their glutes, or their power muscles. But the biceps femoris, which is the main hamstring, there's 3 hamstrings, the semitendinosus, the semimembranosus, and the biceps femoris. And then there's a bunch of crural fascia. And there is a ligament that's the equivalent in humans called the ACL. In dogs, it's called the cranial cruciate ligament. It's my biggest worry with especially pit bulls. They're already a very muscular breed, and they like to go over the top, especially if they're in mountainous terrain. But in all the times that I have been treating Mars, he has never guarded this area like he has today. And by guarding, I mean like biting it, like saying, leave it alone. So I'm just showing you some techniques to do. Hopefully you can see these. These are really easy techniques. So this is, if you can remember, before a hike and definitely after a hike, you got the front of the knee here, and you have a lot of fascia here. It's called the crural fascia. You got fascia up here. You got fascia all over the body, and it's essentially below the skin, above the muscle. But essentially, he's always had very tight hamstrings, always. But this is the tightest I've ever seen them. And I'm trying to save you a $10,000 vet bill and the pain in the ass of going through surgery. I've seen dogs as young as 2 and as old as 12 have the surgery. So it can happen at any age. And even worse, there's a 40% likelihood that when one knee goes, the other knee goes within the year. And that's only because of weight shifting again. So we've already done our primary massage. So this is just some extra. But I'm just trying to show you. So once you have the area, anytime a dog is biting, so I don't know if you can see this, but he's biting the area, he's telling you it's hurting. So pay attention to it. Yeah, pay attention to it. He's not, see how he changed sides? He's like, all right, stop working on that side. You can work on this side. But sweetie, I don't need to work on this side. This side is nice and loose. We already did this side. Okay. Now I gotta lure you back over to show your dad the other side. Okay. All right. This is called work. You get it when it's over. Okay. So we're gonna leave it. This is yours. We're gonna leave it until we finish. I'm not gonna do anything. You know how gentle I am, sweetie. But I gotta show your dad. Yeah. So just warm the area and then use a flat palm, and it's like not critical that you know exactly where the attachment points are. The attachment for the hamstring is up here and down by the knee. It crosses over 2 joints. So it is a significant one, but the one that I'm worried about the most is the cranial cruciate ligament. You see how he's acting funny? And he's a funny boy, aren't you? You're a funny boy, but funnier than usual. You don't want me touching this knee. It hurts, doesn't it? I get it. That's what I'm here for, hon. Okay, so I've given a little video to your dad, about 3 minutes longer than I'm getting better.